Hi, my name is Helen Voronina. I'm a dentist from Paran East, Melbourne. Many of our patients undergo full mouth replacements with dental implants, and they always ask me questions, and these questions tend to repeat themselves. So today I've compiled 10 most common questions about full mouth replacements with dental implants. I want to preface this video by saying that I'm not affiliated with any implant system. I'm not promoting any particular system. The terms that I will be using in this video are all-on-4 and full mouth implants. I'll be using them interchangeably. They mean much the same thing, except all-on-4, which is a commonly used term, relates to a concept, but a concept that's been trademarked by Noble Biocare, which is an implant manufacturer. As I said, I'm not affiliated with any particular implant brand, but I will be using those terms just to make it clear and easy to understand. Essentially, the concept of all-on-4 implants literally means that all teeth on 4 implants. Now, it's not always 4 implants. It can be 5 implants, can be 6 implants. 5 or 6 are better for long-term stability, but 4 implants is the minimum number, and it's usually sufficient. So essentially what happens is, let's say your teeth are removed, implants are placed in at the same time to replace your teeth, and within a couple of days you get what's called an immediate bridge. So these are the teeth that are temporarily attached to your implants. And when I say temporarily, they are fixed to your implants with little screws. And you can wear these teeth for the duration of the healing process, which is about 3 to 5 months. You can smile with these teeth, they're very comfortable, but you have to be very careful eating with them. Until implants are fully integrated, you can't put any pressure on them. If you can think of a similar analogy, if you break your leg, you can't walk on it straight away. If you put any pressure on it, it'll keep breaking. So you have to wait for the fracture to heal before you can put any pressure on it, before you can walk without the crutches. It's the same thing with all-on-4 implants. Even though you get a temporary bridge, you have to be very careful not to apply too much pressure to it. In about 3 to 5 months, this bridge can either be refitted, relined, or a new bridge can be made. That's a longer term bridge. You can also opt for a removable denture instead of a fixed bridge. There are advantages to that. Because it's attached to implants, it's not going to wobble around your mouth like a normal denture. It will be firmly attached, but if you apply enough pressure to it, you can dislodge it for cleaning, and also you can take it out at night, especially if you grind at night. It's a better idea to take it out. But essentially, all-on-4 means all teeth on 4 titanium implants. They're absolutely worth it. I'm not just saying it because I'm the dentist who does them. I'm saying it because thousands of my patients who've had it done have come back and told me how significantly this impacted their lives. To go from loose dentures to fixed implants, to go from decayed teeth and being in constant pain to implants, and to go from loose teeth to something that's fixed and comfortable, you can only imagine what an impact that it has on people's lives. Having said that, this is not a walk in the park. It's a significant, involved surgical procedure. It takes several months from the beginning to end. It's also a costly procedure. So it costs many thousands of dollars. There is no Medicare coverage. Insurance pays very little. So it's a huge commitment. It's a big decision for people. But is it worth it in the end? I have no doubt that it's worth it from what my patients are telling me. The implants themselves are hidden within your jaw, covered by the gum, so you won't see them at all. It's the bridges or the prostheses that are visible, and these are composed of pink gums and teeth. We can make those teeth as perfect as you want them to be. We can give you that smile that you've always dreamed of, or we can make them as natural as you'd like them to be. We could put gaps between your teeth. We can make them longer, shorter, whiter, darker. We can even twist some of the teeth. Or we can make them all straight and white. If you have an idea of what you want them to look like, it really helps us if you bring some photos in of your original smile from years ago, or you find some pictures on Google that you want to show us. There are some limitations with what we can achieve, but with full mouth replacements, it's really easy to give you what you want as far as appearance is concerned. There are very few things in life that are permanent. Same applies to dental implants. They can be lasting and durable, but you do need to expect to maintain them and to replace them at some stage. Implants often outlast the teeth that are attached to them. We often see bridges needing maintenance after a few years. Sometimes a tooth will pop off the bridge. Sometimes a little bit will break. In some situations, the bridge can be repaired, and other times it needs to be replaced. People who grind their teeth need to wear an occlusal splint at night to protect them. Otherwise, there is an increased risk of fractures, increased risk of implant failures. Implants themselves can succumb to infections, a condition that's called periimplantitis. It's a form of gum disease associated with implants. The important factors to make your implants long lasting is to have them done well from the beginning. So the selection of a surgeon is very important, but also to maintain them well. We usually show you how to look after them. If you're meticulous, the chances of them lasting a long time are very, very high. By far the most common question that we get asked is, how much do all-in-4 implants cost? So when you're considering the cost, you need to think of three things. The first one is the cost of the actual surgery and the prosthetic teeth. The second one is the cost of general anesthetic, and the third one is whether you have enough bone or not for all-in-4 implants. If you do, then it's just the cost of the general anesthetic and the implants. If you don't, then you will need some additional bone grafting, which will add to the cost of the overall procedure. So let's talk about each one of those. So the first one is the surgical fee and the fee for the prosthetic teeth. So let's look at just the top jaw. If you just need your top teeth or your bottom teeth replaced, uh, average price in Australia in 2024 is anywhere between $25,000 to $35,000. If you need both top and bottom done, it's approximately double that. You will also need to consider how many implants your dentist recommends to you. If it's 4 implants, it'll cost a little bit less. If it's 5 or 6 implants, it will cost a few $1,000s more. And that's why I'm giving you a broad range. Also, acrylic teeth, which are good and strong teeth, are a little bit cheaper than the upgraded zirconia teeth, which can cost a few $1,000s more. Let's look at general anesthetic. So general anesthetic for a long procedure like that can cost anywhere from $6,500 to $8,500. The good news about it is that you get a significant rebate from Medicare. So essentially you'll only be a few $1,000s out of pocket. If you need multiple surgeries, then you will be paying several anesthetic fees. The good news is if you have more than one general anesthetics in each calendar year, you will get significantly more back from Medicare the second time. And the third factor is whether or not you need bone grafting. Bone grafting can sometimes be done in conjunction with implant surgery, and sometimes it needs to be done prior. And that's only if you don't have enough bone for all and four. Approximate costs can be anywhere from three to ten or even $15,000, depending on the extent of bone grafting that you need. So when we think of implants themselves, implants are titanium screws that are placed into the jaw to hold the teeth. They literally fuse with your jawbone, so they're not removable. However, anything can be removed, but they need to be removed surgically. They're not straightforward to remove. Then when we look at the actual teeth, yes, they are removable. And when I say they are removable, fixed teeth can be unscrewed by the dentist and screwed back in. It can be unscrewed for maintenance or to be replaced or repaired, and they can be screwed back in. You wouldn't be able to do it yourself at home. But you might actually have removable dentures attached to implants, so they are solid and firm, but you can remove them yourself at home for cleaning. You can have your implants anywhere in the world: Thailand, Bali, Switzerland, America, Australia, anywhere you like. There are good surgeons all over the world. The important factors to consider are you going to be living in the country where you have this treatment done? A lot of people think that you can just put them in one day and walk out and you're done. And people who go through the process often come back and tell us, had I known what's involved, I would not have even considered having it done overseas. The process takes anywhere from 5 to 12 months. If it goes smoothly, you will see us maybe once a month or so. If there are complications, you need to ring your dentist immediately so that they can help resolve those complications. What if you have them done in Thailand, you board your flight back to Australia, and you develop an infection on the way back? It's often difficult to get help in Australia for treatment that's done overseas because sometimes we don't have the parts for implants that are used overseas, and sometimes dentists are scared to help you. They don't know what's in your mouth, they don't know what's been done, and to be quite frank, sometimes they don't want to take the responsibility for somebody else's work. So you really need to consider where you're going to be living at the time of having implants done. If you live in Australia and you go to another country to have it done, to save on the cost, which is completely understandable, you need to be aware that you are taking a big risk. Well, all in four is usually done in one day. Often they advertise this teeth in one day. It seems like a miracle, but there is actually a lot more to it. The process takes a lot longer than one day. There is the preparation stage, and that can take a couple of months. The dentist will have a consultation with you, assess your scans, take measurements, pre-make your teeth before the actual surgery. But the surgery happens in one day. You go to sleep, we take the teeth out, we put the implants in, you wake up. You can even sometimes get your temporary teeth the same day, but a lot of the times it takes a couple of days. Then you have to go through the healing process, which will take anywhere from 3 to 6 months. And then you have your teeth refitted or remade. And when I'm saying your teeth, I mean the prosthetic teeth that attach to your implants. With the temporary teeth, there's often a lot of guesswork, and that's why we need to refit them later. Another thing to be aware of is that if you're not suitable for all and four, if you don't have enough bone, you might need to have that bone regenerated with a procedure that's called bone grafting. That could be done at the same time as implant placement, but sometimes it needs to be done prior to implant surgery. And when I'm saying prior, I'm talking at least 5 months, anywhere from 5 to 9 months. So the whole process is quite a lengthy one, but implants are indeed done in a short period of time. There is virtually no pain involved in the procedure. It's hard to believe that considering how involved the surgery is. I guess when you're having the surgery, you are asleep, so you won't feel a thing. You'll wake up, it's all done. It's the healing process that can be uncomfortable, and therefore we prescribe a number of medications, some antibiotics to minimize the risk of infection, some corticosteroids to reduce swelling and bruising and pain, and also some usually Nurofen, non-steroidal anti-inflammatories to minimize pain and swelling. We just about never have patients ringing us back saying that they are in pain, and we see people the next day after the surgery, and when I ask them about how they feel, they say 100% there's no pain. So if your teeth have been missing for a very long time, there is a chance that you might not have enough bone for all-on-4 implants. The concept of all-on-4 implants is actually designed to bypass sinuses. Sinuses are the cavities in the face here, and it's often difficult to place implants underneath sinuses, especially if teeth have been missing for a long time, because what happens is sinuses tend to enlarge and often there's not enough bone underneath. And that's why all-on-4 concept was designed to bypass the sinuses. And what happens is we use an implant and we angulate it 45 degrees away from the sinus. And that enables us to still utilize this all-on-4 concept even in people who have minimum bone left. But there are situations where that's not even possible. Then you have three other options. One option is what's called zygomatic implants. Zygomatic implants are implants that are anchored not in your mouth but in the zygomatic cheekbone, this bone here. As you can imagine, these are very long implants, but they are useful in situations where you can't have the traditional all-on-4 treatment done. Another way is to consider regrowing bone. That can also be done. Bone grafting regenerates bone. So you would need to have that bone regenerated first and then do implants anywhere from 5 to 9 months after the bone grafting procedure. And the third option is an interesting one. It's not a very common one, but there are new implants on the market. They're called biominiature implants. They are designed specifically for people who have extensive bone loss, where they can't have conventional implants. This is a very promising option. It does need a bit more research, long-term research. It's been promising over the last 5 years, but I do exercise a little bit of caution when I recommend this option to my patients. Having all your teeth replaced is such a huge decision. There's no doubt you'll have lots of questions. I hope I've answered some of them for you today, but if you have any more, by all means, just give us a call.